Breathe in.
They destroy the class.
War of the world.
They're obviously not happy. Okay, breathe in. Sit up nice and straight. Breathe in. Breathe out. Okay, it's definitely something here because this went up and down, no problem. This kind of just stayed where it was. So we're going to come back to this rib 1 and 2 in the next technique. Okay, then we're going to go like this. Breathe in. Breathe out.
Same.
Actually, no, these ones move better than this side.
Right.
Why you don't want her to lie down?
Because I'm getting her to breathe. That's
you
it
cannot do
for
it
now.
while she's...
It's easier while you're sitting.
It's easier for me whilst it's sitting. If you want to do it whilst it's laying down, the problem is what, front or up?
On the front, because
Yeah?
I think that now she won't like... she will try to
Compensate in the front.
stabilize herself, and you know you're trying to push or putting hand, and she will...
She's right, there's no way that somebody can stop their ribs moving.
I'm looking at getting her maybe to do some rotation,
Breathe in.
extension or flexion, so I can add in other vectors to
Breathe
do
out.
Play with...
Yeah.
Okay, so for her, we know the upper rib on the right side is not moving very well. We know the mid to lower ribs on this side isn't working very well. So for this technique, I would do here on her left side, and then the next technique I'm going to do up here if I was treating her, yeah? So for this demonstration, we're going to practice here, yeah? Okay, over you come, son. You probably want to move to this table, please, because she needs to go face down. You need to do her mid-left.
If your patient is heavy smoker, do you think there's going to be a...
Into the T-spine, and if there's compensation here, then there's normally sort of some restriction in the ribs. Even through an articulatory process of just mobilising the ribs, I think can actually be quite therapeutic and quite beneficial for most people. So we are going to manipulate. It's a similar technique to where we covered in the articulation. So the crossover is very close. Yeah, absolutely. There are varying ways we can do this. We can make it a little bit more focal, and we can almost banana her away slightly. So I could bring the leg over like this, and I could start to almost side bend the rib cage out. That's absolutely valid. Okay, not a problem. We want to make sure that we don't grab the patient. This for me is very much a momentum technique, and it's about movement with her and with breathing. It has to be done with breathing. Otherwise, again, as with the thoracic manipulation, if you're trying to fight against lung space, pleura, it becomes difficult. This is where we have the old little flick of the heel. That to me is the key element of this. It's this flick. It's a little flick, man. Ladies love it. But what you'll find is when we're in this position, by flicking my heel, you see how my shoulder's going to just internally rotate, because we are going to be driving down over the rib. Now, if we don't internally rotate our shoulder and we stay in this position, all I'll do is compromise the joint. By doing this movement, we lock everything out. Don't worry, I'll take you through it myself. So, we use the rotation of the pelvis. So we're going to bring her towards me, and we are going to counterbalance with a drive down with our opposite hand. So we're almost doing this movement, okay? Now, with the lower ribs, obviously we take out 11 and 12. With the lower portion of the ribs, we bring her over less. When we start working up the rib cage, we've got to bring her over more. This technique is rubbish for ribs 1, 2, 3, and 4, because otherwise I've got to turn into some sort of Cirque du Soleil performer to get to those ribs, when there's a much easier way of doing it. Now, I don't like seeing people grab, because we're going to use the ASIS as our landmark to contact with to pull her round. Now, if she's ticklish, I could put a towel there to add a little bit of a barrier. But I don't want to see you go, all right, love, right, grab it and drag her around, because fingertips are quite uncomfortable. So I do a little tip where I will see all my bloody mosquito bites.
You killed me yesterday.
Freaking mad, it's ridiculous. I look like I've got
It was insane.
pox or something. Anyway, they only go after good-looking people. That's what I've been told. Is I will contact here, and so I actually make this movement. So I contact here, bring her over, and that allows me to just slide my hand underneath without poking my little witch fingers. Yeah?
It's Halloween, so
Yes, true. Yeah. So I can do this movement. Now, can you see? I'm already on my tiptoe. This will allow me now to create a contact point over the ribs. Now, can you see? I create a broad contact and my fingers are directed straight down. As my heel flicks out, my shoulder internally rotates, my fingers now move in line with the ribs. So that's what we want. We want this movement. Yes, my love.
You are putting the fingers between
No,
the ribs or on
no,
the ribs?
no, I'm putting my fingers like that, just on it.
Ah.
Don't want, you can try and slip your fingers between the intercostals if you want to. I ain't got that time. Just over the angle. That's why I create a broad contact. So I try and find where the pain is and go, right, it's there, over, as best as I can. What I find in practice actually, one side will go beautifully and the other side won't. So, you know, I tend to try and work bilaterally. Don't be surprised if you get one side to go and the other side just ain't moving. And we want to have momentum. So I build it up a little bit, and this is where again I use like the little tapping distraction thing. So my lead leg forward, I'm up and over, I'm on my tiptoe, I find the spinous process and I come over the ribs. Now look, I start off by just rocking her towards me. You're right, darling. It's all those cigars. But look, all I'm doing is I'm keeping this straight and I'm just rocking onto my back foot. It stops me having to try and pull her around, because if she's a larger patient, and she's not, if she's a larger patient, I have to use a lot of brute force. Someone like yourself, I don't want to be sort of having to get a winch system just to try and pull them towards me. So I can keep it like so. And you can already see we're getting this torsion effect here. I'm on my tiptoe, but now look, I start to apply counter pressure like this. Look, and it's this movement. You okay?
Yeah.
Obviously we want to work with the breathing, and I'm just going to have a little, oh, there we are, that clicked already. But look, see how I tap? Yeah? And so I say to just relax, relax, relax. Just breathe in and breathe out. And thrust straight down. So we actually got the manipulation by just rotating her towards me. Absolutely fine. So, let me show you on the side. Can you see how if you don't work with the breathing, you get this movement? So on the opposite side, you guys get the best view.
yeah, of course. I need to see it, but closer. Okay, so can I come?
Zoom in, son. So, I bring her towards me. I'm on my tiptoe, yeah? I'm up and over. Spinous process, we're in the ribs. And look, I start to work. So I'm applying a little bit of pressure. Just start to move through. That's all I'm doing. Moving through. Broad contact. My heel is moving. Breathe in and breathe out. There we go. There. And we work down. Yeah? Slow, rhythmical, and with breathing. But you